President Cyril Ramaphosa cited Nelson Mandela Bay, the Sarah Baartman District and the Garden Route as the highest new COVID infection areas in the country currently. He also said several hospitals in the Nelson Mandela Bay Metro have reported a rise in alcohol-related trauma admissions. Now, additional restrictions to the metro include a limit on the time alcohol may be sold, a curfew, and a strict ban of public and large indoor gatherings. The other two districts are still to be reviewed. Ramaphosa also said travel carries great risks. Mask wearing is essential and keeping windows in vehicles open is advisable. Well, joining us now is owner and director of the Institute of Commerce and Management SA, Dr. Raynauld Russon. Good to have you, Dr. Russon. Thanks for being our guest.
Well, good morning, Leanne and your listeners, and good to be on your show.
Indeed. Talk to us about your reaction to the President's address. Is it what you were expecting? Was it along those lines or not really?
Well, every time it comes on television about this pandemic, we all get afraid that it's going to lock us down. He's famous for saying, my fellow South African. But yesterday, I think it was inconsequential. It was a good speech. I think it was a good speech. And we cannot really afford to go through another strict lockdown because it's got devastating effects on our economy. So, yeah, I think it was a good speech.
Yeah. I mean, I think people were expecting a lot more coming out, thinking more of a nationwide restriction. But in reality, I mean, can we afford it as a country to go down into, and I'm not even talking level 5, I'm not even going there, but I'm just saying exactly what's been put into the Nelson Mandela Bay municipality. Can the country afford to go in that direction as a whole?
Well, Leanne, I personally think that the statistics speak for themselves. We've suffered tremendously. In many ways, our economy is bleeding right now. We've been downgraded to junk status, and it's not looking good. And it's because of maybe how we reacted. We had the strictest lockdown globally, and we need to review that. It's important that we must start reacting to some of these issues using our own experiences, our own data sets, and be on control of the situation, instead of mimicking what's happening in the UK or wherever else in the world. Let us be more contextual and specific to our own circumstances. Yeah.
Yeah. I suppose that has been one of that has been one of the criticisms that has been levelled against our original lockdown. I mean, there have been both compliments and criticisms because it was very hard, but it was also very progressive. However, exactly as you're saying, and that has been the criticism, is that we as a country cannot follow Western counterparts. We're in a very different position to them. And although the numbers seem to be following what happened in second waves in Europe, I'm not sure we can afford to be locking down the way that they did. I mean, let's talk about that in terms of how we are aligning ourselves with the way the Western world is reacting to this.
Yeah, we've got different climatic conditions, and they're in the winter now, in the deep of winter, and we're in the summer. So the statistics in winter obviously will worsen. And in our case, in the summer, I think all the evidence states that the coronavirus is not very rampant in warmer conditions because it's a strain of the flu virus that we're understanding. So there is no justification. Our recovery rate is really high. There is no justification for any stricter lockdown. And I commend the president for having responded the way he did to what's happening in the Eastern Cape. That's okay. It's not bad. Like I said, it's inconsequential. But we really cannot afford any more restrictions. And we need to start looking at a balanced approach to this problem. Listen to the protagonists and also listen to the fewer critical voices of the whole debate around this discourse. Yeah.
So let's look at something like what the President advised last night against unnecessary travel. Many lower income South Africans travel home at this time. I mean, as it really is the only chance that they have to actually see family. And again, I mean, it's not only those people that are going home. We are seeing everybody also leaving their respective provinces and holidaying. I mean, we should see already starting to see this weekend a big influx next week. And we're going to see people all over the place. So again, I mean, I know economics is a massive thing in keeping the economy afloat, but you know, the fears, which are rightly so, the rising hospital numbers, the lack of treatment that is available to people that are suffering from COVID, you know, these things are going to be rising as well. So again, I pose the question, do you think it's enough that's been put in place to try and help South Africans?
I think it goes without saying that something has got to be done in terms of controlling behaviors of our people when they're out. You know, the wearing of masks, I think it's very important, and everybody must take that seriously. But again, when you look at our coastal economies, your Durbans, your Cape Towns, etc., this is the time when they expect them to make some money, particularly in the tourism industry. It will be very difficult for the government to stamp down on traveling during this period. But I expect we'll see more police on the roads, checking vehicles, checking that people have got the necessary protective equipment in their cars, they're wearing masks. The controls must be there, I accept that. But I think we just need to be sensitive to the fact that the economy is going to continue to operate, to function. Because without that, I think we're dead in the water.
Yeah, and that's, you know, it goes down to people's behavior, and that's been something that has been highlighted the entire time. And the president again emphasized it last night, saying that, you know, the one effective tool is the whole issue of sanitizing, wearing a mask, and yet some people are not doing this. And, you know, as much as we leave it in people's hands, unfortunately, it just doesn't seem that the behavior is there, and this is affecting everybody else around them. And I mean, let's again keep focusing, because I know your strength obviously is on the economy and looking at commerce and management. So we talk to the issue of hospitality, we talk to the retail industry, we talk to restaurants, clubs, bars, all of these kind of things. And this is where I imagine they're hoping that they will see some income coming in. However, we're also asking people to behave, so it's a fine balancing act. I mean, how badly are they going to be affected by this?
Well, it goes without saying. Like I said before, it's going to be a time when the coastal areas are expecting to make some money. But we need to put in more effort in a national campaign, education campaign, and talk to people. Let's see a lot of adverts going out in the media saying that wear your mask, and talking to the people continuously, because continuous, you know, sensitization goes a long way. And I think people will listen. Our people are actually quite dependable, because they've been listening to the president and taking his advice and doing what he's been saying they must do. But there are certain sections and sports, like in the city centers, where people just behave like there is nothing happening. So I think an educational campaign is important on the part of the state.
I mean, again, I feel like I'm repeating a lot, because this is pretty much so what people are trying to understand, is this the fine balance between saving lives and keeping businesses open while people put food on the table. And this is the reality. And the other harsh reality is that most South Africans are living below the poverty line. And that's, you know, according to stats that have been brought out by Stats SA. Again, I can imagine that the president is under immense pressure to ensure that the wheels of the economy keep on moving, because we just simply can't afford it. And I think you'll see, as we're seeing already, the repercussions of a lockdown are far harder than what is happening with coronavirus.
Actually, you know, the repercussions of not just the lockdown, but the entire pandemic on Africa, it's been devastating, to say the least. And I think more research needs to to be done to find out what has happened. Many small businesses have shut down in the local economies, in the locations are not functioning, and our people depend on those small transactions. I think the support that the government had put in to assist small businesses didn't come through very well, and a lot of businesses that I know, that I've spoken to in the past, did not get access to those accounts, and they are bleeding. They continue to bleed. So I don't know if the government, if the president can do any more to ease the pain of small businesses. I doubt. But I think holistically, the approach to the pandemic is, we've got to really look at that, really, because when I compare statistics, I've done a lot of research in the subject matter. I found that the flu kills more people within 3 months than the virus has in a whole year. But we haven't reacted the way we've done to the influenza. So there seems to be something more than meets the eye here. But I don't want to go there. I'm not a critique or a counter advocate to the pandemic, but I just think we need to be realistic and put the economy and our people first.
Yeah. I mean, Dr. Russon, you're not alone in your thinking, but I suppose there are two ways of looking at this, and that's it is one school of thought as well. I mean, if we look at vaccines as well, and we look at where Africa stands in terms of receiving them, we heard that the president said that we have now put out money to try and secure a vaccine for South Africa. But as we say, that is a conversation for another day. But let's talk of the relief fund, because this has been also a big sticking point in that, we talk about that 350 Rand grant. We talk about some of the other measures that were put in place to assist people during this time, and some saying that just was not enough. I mean, the relief fund performed in sustaining and helping businesses, especially the vulnerable and small businesses who really have claimed about their inability to access funding. Has it done enough, this relief fund?
Well, we commend the government for having introduced the relief fund, but it was too little, too late. And I think it's got to be sustained. And my personal viewpoint is that we need to increase this to about 1,500 a month for unemployed people. It must be a permanent policy position, because unemployment is continuing to grow and people don't get money out there. I'm a strong advocate of the principle of monetary velocity. And the only way we can do or promote monetary velocity is to introduce unemployment grants and increase the money that circulates into the economy, because modern economics now is about the speed at which money circulates in the economy. It's no longer the old-fashioned supply and demand. That still matters, yeah, fair enough, but monetary velocity is the new term that we need to look at. How do we increase the speed of money in the economy? And giving people money, increasing grants, is one of the ways to enhance monetary velocity.
Yeah. One of the interesting things you spoke about is also the effect on the African continent. And this has been a very dramatic shift. I mean, the divide between the Western different worlds and continents, and now Africa has grown even bigger. And I think Africa has fallen behind. I mean, that is just we're talking about in technology, we're talking about the infrastructure and many other issues. And this has been a very, very detrimental year for the continent going forward. I mean, how do we look within to try and change it for ourselves? Because, we've realized that being dependent on the outside world, sometimes you've got to realize that you've got to look within first.
That's such an important point you're raising there, Leanne. I think our retail sector realized that, if you depend on imports, and when the economies were locked down, they ran out of stock. So it's time to look internally and look at what supplies we can get, what goods we can make ourselves. And for South Africa as a country, we need to take lead in the continent. And we shouldn't be ashamed of taking the lead in the continent. I mean, every region or economic region has a power force, and we should become that. We wanted to become the gateway to economic development in Africa, but we haven't done that. So we need to be shameless in taking the lead and positioning our country as a lead in the African continent. And to do that, the one thing we must try and explore is emphasize quality. A lot of African countries and economies have suffered buying cheap goods from the East, and cheap is expensive.
Yeah.
And to try and change the trend, so we must take the lead and emphasize quality products, and will make huge impact in the world and in the continent.
Absolutely. Dr. Russon, thank you for talking to us. It's great to have your views and opinions here on the program. And thanks again, just wrapping that up. That was our guest talking to us about those new restrictions put in by the president and also the effects of COVID we've seen throughout the year. The owner and director of the Institute of Commerce and Management SA, Dr. Raynauld Russon.